I think the most important was the characterization of people who you might recruit to a trial over time before you put them in the trial. So the Dementias Platform UK, the importance of understanding the trajectory the person had and the impact of other aspects of their medical history or age or family history that could have on their trajectory. One of the issues that we have grappled with in the past has been that we look at one point in time at baseline, or perhaps after a screening period, and then baseline, and then we don't really look in any depth at the impact of other factors on their rate of decline or improvement. I think this can have implications for the size of our trials and for better understanding how one can extrapolate results from clinical trials to the general population. I think that we are making progress, and patients in the world out there want to see that, and they want to understand, after all the negative results that we have, that we are beginning to see some positive results. A lot of people have been wondering when we're going to have a new treatment that can help people who have established dementia. And I think the other important take home for me for clinical practice was the use of remote assessments and apps. Patients find it very useful. Whether you're monitoring an activity, a physical activity, or a mental activity, I think that the remote assessment response to an intervention, whether that's pharmacological or non-pharmacological, would be very useful in practice. I think my key takeaway from this is related to the cognition therapeutics intervention based on the Icelandic mutation, where you take a mechanism that you know is protective. They have shown how translation and reverse translation can work, and I think all too often we have animal models that don't truly represent the disease. We have technologies that aren't targeted necessarily at the mechanisms that are going to produce the greatest effect. Having said all that, I think what we are going to need is many treatments. What we need to generate is models of treatment that take into account all aspects and adapt the Jack curves to represent when is the right time to intervene with all these targets.